Hi, my name is Dr. Vipin Sisodia. I am a urologist working in Yatharth group of hospitals, mainly at greaternoida branch. I think today we are going to discuss about kidney stones or renal stones. It is the stones that are formed in kidney. They sometimes moved into ureter and bladder, and when the stones moves into ureter, it will cause pain. That is how we are going to discuss this. It is a very common entity, very common in North India, in whole India. I think India comes in the stone belt of the world. So the incidence is around 10% in the US and on all Asian countries. So 10% people, usually more in males, less in females, 11 and 9% respectively, is the incidence of stones. The stones, mainly the patient comes with the complaints of pain in the loin region, the side of the back. They complain of pain, they will have vomiting, they will have blood in the urine, and sometimes they complain of fever also. Fever is a very emergency sign. If these complaints are present, the patient usually comes to us. And after that, after examining the patient, checking his vitals, his or her vitals and blood pressure, we investigate the patient. We investigate the patient after doing an ultrasound, we do x-rays, we do CT scans. And the diagnosis will be made with the help of clinical diagnosis, the clinical symptoms the patient has, and along with our ultrasound. After the diagnosis is made, if the stone is small, we will try to pass, and all the reports are normal. We will try medical treatment so the stone can pass on its own. We should avoid surgeries if and possible every time. But if the stone is big or it is stuck in the ureter, not coming out and causing more discomfort to the patient or causing infection in the kidney, it should be removed. There are few techniques that we are using. I think there are very few techniques that have come into the market, very recent techniques. So the older techniques include URSL, you put a smaller scopes in the ureter and take it out with laser. Now the new techniques are, I think previously we used to put a big incisions on the kidney, on the abdomen to take out the stone. Now it has become with a single hole after passage of some time. Now the stone surgery has become stoneless, the stitchless surgery, the scarless surgery. People are undergoing surgery and next day they are going for their work. So the technique of RIRS, retrograde intrarenal surgery with laser, has revolutionized the process of the stone surgery. So you can undergo surgery without having any scar and patient will improve within no time. So RIRS is a technique, that is the technique of choice nowadays for stones. That is what we are doing here in our setup. I think we are doing maximum number of RIRSs in whole of Noida and Greater Noida. When the stone has been out, then the treatment, this is the half treatment. The half treatment is how to prevent the recurrences. So when the stone is out, we have to take lots and lots of water. There is a very common, I think, myth saying in the society, have more and more beer, the stone will not form. This is, I think, a very, very false propaganda that is going on. The reason we don't know for sure, but I think alcohol, any alcohol intake will cause more of diuresis, to increase the urine output, will cause dehydration and will lead to more stone formation. So lots and lots of water is a good option, not an alcohol. So the all treatment will depend upon the types of stone. This has to be dealt, I think, is a very big topic. I have to have taken a separate video for that. So I will stop with this, and I think we are having every facilities of stone treatment here at our hospital. You can come and see us. Thank you.